late start, but technology was not our friend. But we got it all dialed in, and here we go. So can the clerk please call the roll?
Board Chair Hitchen,
I am here.
Vice Chair Bushnell,
Present.
Board Member Herrera,
Excused.
Board Member Mello,
Here.
Board Member Olson,
Excused.
Board Member Ryasich,
Here.
Board Member Sadalge,
Here.
Board Member Yambe,
Board Member Yambe, we heard you make a sound.
I'm here.
There we go.
Alternate Board Member Cook, Alternate Board Member Ayala,
Here.
Alternate Board Member Diaz, Alternate Board Member Merrick, Alternate Board Member Fleming. Roll call is complete.
Thank you. For those of you that are here, both personally or online, we have two updates this afternoon, and then we do have an executive session this afternoon. There will be a calendar invite for those of you that are virtual coming your way. So I'm going to turn this over to Jessica Gailey and Katie Lott to update us on the DIY septic program.
Good afternoon, Chair Hitchen, Vice Chair Bushnell, members of the board. We are back to talk about septic systems again. You've heard from us a lot this year about all of the new and interesting things that we're doing in this program to try and increase our options for homeowners and to save them money wherever we can, while also ensuring that we're protecting water quality and drinking water sources from untreated septic system. So today we'll talk about our typical kind of linkage to our strategic plan. We'll give you a very, very brief overview of septic systems in Pierce County. Just as a reminder, we've spent a lot of time recently talking about the details of this, but just a quick overview. Katie Lott, our Environmental Health Assistant Division Director, is going to share with you more details about our pilot project for this effort, and she was the coordinator for all of this work. And then we'll review options for our homeowners just to make sure that I can just jump in the agenda slide. And then we'll quickly review our options for our homeowners because we do have several options for folks, and then give you the opportunity to ask us any questions that you might have. Next slide, please. So our on-site sewage and drinking water program supports our department's strategic priority to increase efficiency and effectiveness of our department operations. We focus on implementing process improvements of all sizes. There's always opportunities for us to streamline our services for our customers, and while still maintaining public health priorities as well too. Next slide. This is the very brief overview of septic systems in Pierce County that I mentioned. We have just over 90,000 permitted septic systems as of 2025. And last year, just for some context, we had just under 500 septic systems that reported failures. Next slide. There is in the WAC 246, there is a statement that allows the local health officer to establish a homeowner inspection certification process. The code does not specify the details of what this process should look like, and it also doesn't require a local health jurisdiction to have one, but it is in there and it allows us to be able to do this. So now I'm going to hand this off to Katie.
Good afternoon, Chair, members of the board. Katie Lott, Assistant Division Director, Environmental Health. Over the course of about a month, we connected with individuals who were interested in a pilot. We began the pilot project in September of last year. In order to participate in the pilot, folks needed to be living in the property. They needed to have a gravity, which is a simple septic system, and not on a shoreline. Out of the 25 people that we connected with, 19 of them did not participate for various reasons. They were either interested in the reduced 3 to 5 year reduced inspection frequency option. They either had a complex system, so something that was not a gravity, or they were on the shoreline. If you remember earlier, right before we began this pilot project, we started a option for people to increase the frequency of their inspection from 3 to 5 years decrease. And so folks who learned about that were really excited about that option and wanted to do that option instead. The 6 that did participate in the DIY pilot all happened to reside in the Gig Harbor Key Peninsula area. And next slide. In a formal scope of work, we asked those individuals to review some study materials, watch online videos that are posted on the Department of Health website, and then complete a test. After they did that, they reviewed their septic system information, their property inspection history, and their as-built, which is the drawing that describes their system. While they were after they had completed those steps, they completed their own inspection and a checklist while we had a health department technical expert observe them. And then they gave permission for a certified professional to do a operation and maintenance inspection on that property. And when everything was said and done, they came in and provided us feedback. All the participants received their materials in the middle of September. And this table shows you that the time to complete the project varied. And we gave individuals till the end of the year to participate, to complete that project. So it, some folks took a little bit longer to review the study materials, and other folks had a hard time locating their system. And so that timeline allowed flexibility for them to be able to complete the project. In the feedback session, some of the information that we gathered was that folks found the videos and the checklist helpful and easy to follow. They appreciated having our health department staff there to ask questions and give feedback. And they also needed to refer back to the videos and study materials in order to answer the test questions. We did hear that they wanted the DIY option to remain affordable. The things that we observed in this process, there are about a dozen jurisdictions that have DIY options out of the 35 in the Washington state. Some of them vary in cost from nothing to several $100s, and they all vary on course material needed and certification level. The videos from Department of Health that are available offer basic education, but they are not intended to provide training for somebody on how to do their septic inspection. There is a disclaimer on Washington State Department of Health's website that says that the videos are intended for educational purposes, and the jurisdictions that use them in conjunction with a class that they either provide or have another entity provide that course. We understood that property owners had a hard time either understanding or locating their property records. Some of the older systems have very basic drawings, not necessarily to scale, and some of them are hand-drawn. They're not the technical CAD drawings that new systems have today. Those that had lived technical hands-on experience had an easier time completing their inspections, and the inspections required movement and strength. I can speak from experience. When I moved onto a property that has a septic system and did not have risers, I thought I would go ahead and save myself some money, and didn't realize that the first one out of 4 septic lids was 4 feet down, and in our soil that was more than I wanted to take on. So after finding the first one and the 50-pound lid at the bottom of it, I called a company to come in and finish the job for me. The other thing that we discovered was that the homemade versus professional scum and sludge judge differences were minimal in what they measured in the tanks. So out of all of that came our recommendation that we would partner with the Washington State Onsite Sewage System Association, WOSA, to provide the course and the test. They are the local experts in providing septic education. They are the ones who certify all of our professionals, and we are fortunate enough that we have that resource local. They have a hands-on training classroom and outside basically septic system mock-ups that people can learn on, work, actually see the components, and that would be a great resource for our county. And so we're really thankful to have that here. We also knew it would be really important to have a regular cadence between the homeowner trained inspection and a certified inspection. And so we recommend that we alternate those. So for every other year, every other inspection would be done by a septic professional. And then we would continue to require a certified professional to complete all property transfer inspections, because that's a really important time for folks to be able to identify and fix any issues before transferring it to another individual. And then lastly, we really would like for anybody who is interested in doing the DIY program to connect with us. We would make sure that their property meets the requirements to do the self-inspections, and then we would connect them with WOSA to make sure that they were enrolling in the right course.
If we have a homeowner who maybe has an inspection that's coming due soon, but Washington On-Site Sewage System Association doesn't have a course for 3 months after that date. We will gladly work with them to adjust their date, and they won't have any repercussions of it being late. So we're willing to work with folks on that front. So what are our options? Next slide, please. And actually one more. So what are our options for homeowners? So we wanted to just take a moment to review the options that people have, and also wanted to share with you all that we just posted a blog today, hot off the press. It should be in your inboxes, that's telling our community about the DIY option, and then also pointing them to our website so that they can see the reduced inspection frequency option as well too. And really, like Katie, just to emphasize that point again, that we really want folks reaching out to us. We can make sure that everything is lined up and ready for them to go. We don't want folks kind of going down a path to figure this out themselves. We want to make sure that they have all of their records available to them and all the information that they need to do this appropriately. So we do have working with a certified professional is still an option for folks. There are many people who have no interest in conducting their own inspection. There are many people who don't qualify for the reduced inspection frequency. We know that there are septic systems across the county that do qualify for that option, but there are some that simply don't because they don't meet the criteria. So working with a certified professional is always welcomed. For our reduced inspection frequency, you can see on the table that if you need to be on a particular type of system, you need to not be on a shoreline, there are some criteria to meet. We provide that education class. You've heard us talk about that. And then really then that becomes that a certified professional conducts that inspection every 5 years instead of every 3. And then for the DIY option, it is very focused on those gravity simple systems. And our recommendation is that we work with WOSA, who is the expert for training and educating not only just homeowners and people interested in septic systems, but those who work with septic systems, installers, take a certified course with them and pass an exam. And our O&M professionals as well too. And so this would mean that there would be a certified professional every 6 years, so every other time. So this is just a summary slide to remind the public and you all about what options are out there. Next slide, please. Also wanted to just remind everybody that we do have financial assistance available. There are a variety of different ways that we do this. One is that we can offer an extension if somebody is just not in a place where they can pay for an inspection and they maybe don't meet our financial assistance criteria. We can offer an extension for them. We're willing to work with folks. There is an organization called Craft 3 that offers repair loans or replacement loans. These are for really major tens of thousands of dollar fixes that might be required. They generally are low to no interest loans that typically aren't due until the sale of the house. And then we have some financial assistance dollars available that I know you've heard about from us, where we can reduce the cost of routine inspection, riser installation, tank pumping, and sometimes minor repairs, depending on what they are. So we work directly with the certified professional companies, so the homeowner doesn't have to pay for the full cost. They see that reduction on their bill, and so we work to reimburse the certified professional. We do have a variety of different geographic areas where we offer financial assistance and try to make this a really low barrier option for folks who are in those areas. And lastly, next slide, please. You've heard us say that every time we have a septic presentation, we're always going to talk about installing secondary safety devices as a best practice. It really can prevent injury and even death in our pets and our loved ones. And our septic companies are really on board with getting these devices installed into systems. The newer systems are not the ones that we're so worried about, but that's the ones that were already in the ground. So this past year, we did make a decision to extend the financial assistance to help pay for the installation of some of the secondary safety devices. So that's just a reminder. And that's what we have for you all today.
Thank you, Ms. Gailey. Questions from board members? I feel like we all are experts now. Vice Chair.
Thank you, Chair. Just thank you for the presentation. I appreciate all the updates. My question is in particular around the safety devices. Could you remind me, is that currently an optional thing that during inspection is like, hey, like just FYI, these are dangerous and we have some financial assistance to get it. Could you talk about that a little bit more?
Yeah, we do share that as an option when people are signing up for financial assistance. Our septic professionals also talk about these a lot. We do have some tank manufacturers that don't manufacture a tank without these already installed. So there are some, no pun intended, safety nets in place. So but really it's some of those older systems. So as a way to kind of start to capture some of that information, all inspections are reported through an online database, and we have added a checkbox in that reporting system to ask the certified professional to say if there were secondary safety devices installed or not. So there is another piece on that reporting is whether or not the tanks are screwed down, bolted down when the septic professional is there. Our staff also check for that too, but of course we don't know what happens when they leave or we leave the house. Sometimes those things, tank lids break for a variety of reasons. So we're trying to build in some ways to collect some data around what might be out there.
Yeah, no, that's super helpful. That was like my second question is like, how do we know how many do or don't have these? And then could you talk about how much they would typically cost to install something like this? For
Yeah, I
legacy
think
system?
Katie and Laurel, our program manager over the circle, have them come up and answer that. It depends. That's the short answer.
So the installation of it depends on the type, and if it's a system that's already risered, the devices themselves, can be around, there are multiple types, but around $50 to $100. But then the cost of installing them varies based on company and what they have to do to install them.
Gotcha. That makes a lot of sense. Could vary a little bit. The reason why I go down this path is because it's an entirely preventable accident that occurs. And these, I think, would be really great for that. And so any way that we can support encouraging folks to install these and finding ways that we can help with that, I think is really good.
Yeah, one of the ways that we can help and certified professionals can help is that if that certified professional is already out at the home working with that homeowner, that's a great time for them to just do the installation of those secondary safety devices. So we do talk to folks about that as well too. If the kind of major cost is getting the person out to your house, the devices themselves are relatively inexpensive.
Great. Thank you. Thank you, Chair.
Thank you. Any additional questions?
Thank you, Chair. Of the, you said 92,000 or so septic systems, how many in the county qualify for these programs? In other words, how many aren't A, B, C, and D? And I guess the second question then becomes, how many people do you expect to take advantage of these opportunities?
I'll have Laurel come up and answer.
Hi, Laurel Jellison, Program Manager for the Onsite Sewage and Drinking Water Program. I don't have the exact numbers, but I think we estimated about 50,000 that were
So more than half.
eligible, kind of half,
Okay.
yeah. And of course, then you have to look at location and the requirements. But yeah, there's a good number.
Okay. And you expect a lot of people to do this, a few people to do this? And
I would say in other counties, I mean, I think when you look at other counties, we have some counties that have had hardly anybody take advantage of them. Other counties, they don't even have certified professionals this time across the state, like the east side. They're really working to develop a program to certify professionals. So for those, the do-it-yourself is better than having no inspection at all. I think it very much varies across county to county and where people are at.
It's going to be interesting to see.
So yeah, we'll be interested to see. I think it's been very telling that many of the people that we reached out to that were very interested when they saw a 3 to 5 year reduced inspection frequency, because it's the difference of inspection every 5 years or 6 years. They've opted for that right away because it's easier for them. And it's a difference in a year. So we'll see. I think it's great that we'll have the option for our community and they can make the decision.
Thank you.
Thank you. We like it when we phone a friend. I think my only question is, we had at least one community member that reached out and explicitly talked about a different program, I think, than the one that we've gone with. Can you help us understand? I'm guessing, I could be speaking out of turn, but it was the Kitsap did something differently and it's not the WOSA program. Could you just help us understanding? Casey reaches out again.
Yes, so we did adapt Kitsap's model. So Kitsap has some more steps than what we baked into this kind of first iteration of DIY. I believe that they have a health department person go out to the homeowner's house who goes through a homeowner certified program and does probably something similar to what we did for our pilot project. We just simply don't have the staffing capacity to do that. So that was another reason why we wanted to make sure that homeowners had hands-on, really in-depth training, not just education for doing this inspection. But they do lean to WOSA or other organizations that might provide septic training for homeowners as their kind of training component.
Okay, thank you. I think we probably have more septic systems in our county too, but
Definitely
so the number. Yeah. So, okay. Well, thank you. I'm not seeing any other questions. Appreciate the follow-up on this because it has definitely been an arc as we kind of get to the finished product. So
Thank you.
excited to see this roll out, and we'll maybe get an update on how many take advantage in the future. Next, we're going to hear from Benji Biddle on an update with where we are with the strategic planning of the health department.
Try again. Good afternoon, Chair Hitchen, Vice Chair Bushnell, members of the board. It's July, so we've had fireworks, we've had World Cup games, we've had outdoor concerts, we've had pride festivals, and today we're celebrating with a focus on process improvement at the health department. Welcome to our miniature celebration here. I'll be your convener and host, Benji Biddle, your Director of Strategic Planning. Looking at the agenda for today's presentation, we're going to talk a bit about how this aligns with the strategic plan and really how all of this work that you heard about with the septic system and what the other examples you hear fit into a larger vision that we have of creating a culture of quality at the health department. We'll get some more speakers to be our fireworks, our outdoor concerts, and our barbecues to come up and make this more lively for you. You'll hear about practical, tangible examples because process improvement can be kind of dry. And then finally, how we're moving it forward through performance management. In the strategic plan, you already saw, we have an ambitious goal of 100 process improvements by 2029 and to commit and to track continuous process improvement throughout the department. So this is the frameworks I'm going to talk about. Right now, Chantel and several of our other leaders of the department are at the National Association of County and City Health Officials Conference back in Louisville, Kentucky. And NACCHO provides a real roadmap for us as local health departments to create a culture of quality throughout the department. It's an intensive, long-term goal. There's 6 phases, everything from the staff and everyone really knows nothing about quality improvement all the way to it's second nature, and we have formal tools and it's really embedded in our culture. And we're somewhere in the middle of all of that, I would say. There's also multiple layers of culture of quality improvement, from infrastructure needs to leadership to support to all kinds of tools and systems and processes that support it. And I would say process improvement is just one component of that, but that's the one we really want to dive into today to let you know how we're doing. So NACCHO talks about this culture of quality. You can see the wheel here, which is centered around equity. Most of the strategic plan presentations that you've heard about so far have been in the red, orange, and the yellow, green sections, which are really the sexier parts of why we do public health. It's about the programs and services we offer. Today, we're up in the purple and the blue area, which is more around quality assurance. So specifically, that purple piece that is around improve and innovate through evaluation, research, quality improvement. And the three examples you'll hear about today really relate to the other colors in the wheel: build and maintain a strong organizational infrastructure for public health, which in this case is going to be talking about our funding systems and processes; building a diverse and skilled workforce, where you'll hear from human resources; and enabling equitable access, where you'll hear other good examples coming from the environmental health program. The other thing I wanted to hit on this before we go on is there's a second whole track and framework for doing quality improvement work with local health departments, and that's through the accreditation board. You'll remember in December at the year in review, we celebrated being reaccredited. It's really fantastic, but it's not just a seal of approval. It's really meant to be an ongoing partner with us to help us continually improve our systems, see how we're comparing to our peers, where we can make improvements. And, not to say we're doing anything wrong, but there's always things we can do better and better and better as technology comes along and new innovations come to the field. So this is also part of our accreditation process, is the long and the short of it. All right, so enough from me. Next up, I want you to hear from some of the people doing the work proper. In each of the three strategic priority areas, we're doing a lot of process improvements to meet that 100 process improvement goal. The first up is improve health outcomes. And my colleague, Jennifer Thompson, who's the grant manager, has been doing a ton of work around improving our grant management processes and tools. I don't think you've heard from her in a long time, so she's got a lot of good work to report. So you're up, Jennifer.
Hello. Thank you for having me, Chair Hitchin, Vice Chair Bushnell, and other members of the board. I'm Jennifer Thompson, the grant manager, a position that did not really exist before the strategic plan. So I'm happy to be here and share some of the work I've done in this position with the help of my colleagues and my supervisor, Chief of Staff, Jody Dyer. Before my position was created, grant management was decentralized, where grants were managed and tracked within the programs or the larger divisions. That previous system came with some benefits of working quickly and independently, but created challenges coordinating across programs, the transparency of the grants we had and the staff committed to them. And without centralized oversight, each program had their own strategy that may or may not align with the departments. So to centralize things initially, I created an organizational grant profile to understand all the different grants we had across the department. We pulled a grant list and figured out where they came from, how much they were, what programs they were going to, et cetera, and then analyzed that data to see which divisions and programs were dependent on which agencies and at which levels: federal, state, local, et cetera. This gave us a starting place to understand where our strengths were and where we should monitor risk. I also interviewed program managers and support staff leads like IT, HR, comms to uncover their needs and wants around grants, the challenges they had. And a theme emerged that the support service leads really wanted to be brought into the application process early enough to shape their program's resources and commitments regarding grants so they could plan for their year out. That foundational work led us to create a new process for the programs applying for grants and an updated grant policy to match. Our application approval process now incorporates department-wide strategic thinking on front end of the application. It ties funding efforts to our strategic plan. It gets buy-in from leadership and improves the coordination with our support services. And thanks to IT and our CDC Foundation software engineer, we were able to create this process electronically as well. Unfortunately, we know public health funding is getting smaller and smaller. But even in the best of times, we know grants don't get renewed in perpetuity. So we wanted a way to be agile and make informed decisions when grants end. We wanted to position ourselves to be proactive and strategic instead of reactive and unprepared. This creates an opportunity for systems level coordination and alignment. So to do this, we looked at the risk of individual grants, having when they ended, what impact it would be to the community and to staffing at the health department. We paid particular attention to federal funding because some of their core requirements are in flux and grants have been unexpectedly canceled in the recent past. This risk information can be used by the department leadership to know where risk is, to make informed decisions about how to use our resources, like flexible funding, like such as FPHS funding. It identifies where we might need to reinforce a program if it was at high threat, and then I can work with that program manager to identify more stable funding sources. We also use the data for coordinating losses that occur across the sectors. So department leadership participate in countywide efforts to identify funding cuts and restrictive policies or legal opinions, and our epidemiologists provide population impact for the restrictions and cuts. Finally, to make sure we are good stewards of the funding we are getting, we developed a regular spending report for leadership that incorporates program managers' plans to spend down funds that are ending in the next 3 to 6 months. This regular check-in helps us stay on track to avoid leaving money on the table with our grants. And the dashboard on the slide gives a view of some of the visualizations that are in the spend down report with just got fictitious data for display today. This report, partnered with that risk information, gives leadership awareness of the state of grants to make those informed decisions about spending and flexible funds. And all of our new processes, data, visualizations we've created are helping us to be forward-thinking and prioritize areas of need. Any questions you have for me before I pass it off to Sinden?
Let's pause and see if there are questions. Board Member Sadalge.
I just kind of wanted to understand. First of all, thank you very much. This is really amazing that we have the ability to, I think the last point you made, which is to have regular check-ins and review and see where we're going in a very intentional manner. I think in the larger context of governance in this country, I think that's more important than ever in many ways. I just want to kind of understand these grants, like typically how long a time period are we like kind of thinking? Are they 3 months, 6 months, multi-year?
I would say most are year to a couple years. There are a couple that are less than a full year, but that's usually a very small grant. And then there are a few that a lot of our grants are yearly, but they just get renewed every year. And then others are multi-year, that 3 to 5 year time frame. And we do have a couple of grants that are the money is given to us and it's just spend it until it's done. And then maybe we would get another contract for additional funds.
Got it. And so I think that leads to the underlying question I had, which is around, do you see this or have you guys already started applying this to the budgeting process on a regular basis? And also it's not just about, grant management isn't, I'm assuming, about like you have the grant and how are you using it. It's also about how are you setting up to get the renewals or how are you setting up to manage the end of life of a grant if it is an end of grant. That's what I'm assuming is
Yes.
happening.
Yes. So that is definitely future work that we're looking at. We're also looking at potentially doing like a post-mortem of ones that we finished to see how much did we spend? Did we meet all our deliverables? And really like dive into that type of thing too. But took a fair amount of time to figure out our grant profile and get that first application for the first process for our applications in place. Because we had never had that. Or I think there was one, but I don't know if it was really being used like to the letter. So we're reinstalling that and really updating it. So that took a great deal of time, but now we're starting to look at kind of the management of the grants and what we're doing and how we're using it.
Well, I'm excited to see where this will evolve to and grow to, because I think there's some real fundamental questions that we on the board are going to be, better, better informed based on the work you're doing here. So thank you.
Excited to share all of my data. Thank you.
Thank you for the question. Any additional questions before she goes away too far? Not seeing any, so thank you.
Good afternoon, Chair Hitchin, Vice Chair Bushnell, and members of the board. I'm Sindin Jitsi, Deputy Director, and I'm going to talk about some process improvement work that we've been doing in human resources. So I think you'll agree with me that our organization thrives really because of the dedication, skill, and passion of our staff. Last year, staff from Human Resources, our Assessment, Evaluation, and Epidemiology, or AEE program, and Communications developed a 5-year workforce development plan for the health department. And that plan outlined several improvements and enhancements to how we invest in and train our staff and improve our organizational culture, which aligns with and supports our strategic priority number 2 in our strategic plan. Our workforce development plan outlines many ways that we currently or plan to provide opportunities for professional growth that create a workplace where employees feel that they are valued and belong. I'll briefly highlight 3 specific areas where we've made some improvements in the past 2 years. The first is our volunteer and intern program. So we can help shape the next generation of public health professionals while strengthening our own team by hosting students and volunteers at the health department. We enhanced our volunteer and intern program with a volunteer program support portal on our internal SharePoint page or SharePoint site. And it has resources, success stories of past interns and volunteers, and request forms to make it easier for staff to request and hire volunteers and interns. And then also for the first time this summer, we're actually going to have a couple of paid interns. So previously up to this point, we have not paid our interns to do work as, part of their student curricula or whatever the circumstance is. And we're really excited about being able to do this because this is really an equity issue, right? Because paying interns removes a barrier for students who don't have the financial means to work without getting paid to gain that valuable work experience with us. So we're really excited. We've got 2 graduate level interns starting with our AE program to do. One is focused, I believe, on qualitative work and some other quantitative analysis. And both are working on projects that will help inform us and Pierce County residents about the important health issues. So it benefits us and the community as well. I'm going to move to recruitment and selection. HR staff have been continually updating and improving our recruitment and selection process. Recently, we've been working with an HR expert at Nash Consulting. The board approved a contract, I think, a couple months ago to review, assess, and improve our current recruiting process in real time while also helping us to fill our vacancy for an HR manager. And once we hire that person, the priorities for this new HR manager include leading formal process improvement projects for recruitment, to include a revision of our policy and procedure, for our onboarding process, and for our learning management system. And then finally, I'll talk a little bit about workforce development, specifically some new training opportunities. Later this month, all health department program managers and supervisors will begin a 6-session series of best practice management skills, also provided by Nash Consulting. We're really excited to share the learnings that our senior leadership team adopted when we participated in this training earlier this year, or this past year. And then extending this training to the next level of our management will really help us build a healthy, productive workplace environment throughout the entire organization. In addition to that training, our new workforce development plan includes a quarterly learning plan that identifies required safety trainings, trainings that reinforce our policies and procedures with staff, anti-bias training for staff who are involved in the recruitment process, records retention refreshers, and other trainings that staff identified that they need. Potential Unleashed consultants, some of you may be familiar with the organization Potential Unleashed, and this was also a contract that the board approved, I believe. Actually, no, I take that back. It was a smaller amount, so it didn't come before the board. But again, many of you are familiar with Potential Unleashed. We've contracted with them to do an assessment of the health department, and they're also going to be recommending some trainings that would be appropriate for staff that focus around equity. So we have a lot coming our way as well around training. And then finally, we've been rethinking how we provide employees with information about all the resources and benefits that we provide to them. We used to do one big benefits fair in October where we kind of crammed all the information in there. And based on some employee feedback and, again, some process improvement work, we've now spread those out into multiple events throughout the year. So we do have a benefits fair in the fall. We have an employee resource event that shares EAP information, wellness resources, resume and interview tips. And then we also added new this year a financial wellness event that provided information from TERS, our retirement system, and other financial resources to help our staff. And again, our goal is to improve and enhance our organizational culture, and that really, one huge component of that is through workforce development. So I'm happy to answer any questions that you might have.
Thank you. Are there questions on the HR side of things? Alternate Board Member Ayala.
Thank you, Chair. Just one quick question. At the beginning of your presentation, you named 3 different departments that helped inform the workforce development plan. Can you walk us through the rationale behind why those 3 and
Sure. No, and thank you for the question, because I actually would love to clarify. Those are the 3 programs that put the report together. So I wanted to share kudos to our communications, AEE, and HR teams for putting the actual report together. It was informed by several different assessments and staff surveys. So a lot of the recommendations and plan that's included, work plan that's included in the workforce development plan came from what we learned directly from staff. So there was an equity, self-assessment, equity report that we had that informed kind of how we were doing. Benji talked about we're kind of in the middle or on the QI scale. And so it also kind of assessed where we are with equity, from not having any programs and services to, really being gold star standard. And so we identified where we were and what we needed to grow in that area. We also had a workforce development survey that staff participated in where we asked them what kinds of training they need. We asked them to rank and kind of do a self-assessment of their own capacity in different areas related to public health capabilities. So there were different sources like that helped inform the plan.
Thank you for the question. Any additional questions? Not seeing any, so thank you.
Okay, and now I'm going to turn it over again to Environmental Health Division Director Jessica Gailey.
Good afternoon again, Environmental Health Division Director Jessica Gailey. It's nice to be back up here talking about some of the process improvement work that we have going on in environmental health. Like I mentioned in my previous presentation, there is no shortage of process improvement areas in environmental health, particularly where we're processing a lot of applications. We're doing a lot of widget production. So not all of our work falls into that, but we do have a lot of opportunity. So one of the ways that we have improved our communication with customers, so we launched a new database last year. It was a major undertaking, multi-year process. We switched to a brand new database because the database that we were on was no longer being supported by the developer. And so with that comes lots of kinks in the process, and we are continuing still and probably will for many years updating that system, making it work best for our customers and making it work well on the back end for us too. We've improved our customer payment portal because customers were having a hard time finding and paying their invoices online. So we submit these invoices to have them pay us for our services, and they were having a difficult time doing that. So in the process of not being able to figure out how to pay invoices, they were accruing a late fee, which is not good. So we've fixed that issue, and our customers now are more easily able to submit invoices just by changing some of the labels on our payment portal. Something that seems really straightforward, but I think when you're putting a process out there, maybe it can be overlooked. For a consistent workflow, so this is one where we have a lot of things happening. We now have a report in our database that helps our food safety team capture any data entry errors when we go out and maybe missed entering the next routine inspection for a food service establishment. So while we do these routine inspections are unannounced, we do need to schedule them in our system so that our inspectors can plan their day. And so we now have a report that helps us make sure that we are not missing any data entry errors for getting that next routine inspection noted in the system, and that restaurants and food service establishments aren't falling through the crack. We're digging deep into details on our inspection process, our enforcement practices, and training procedures in our food safety program. So you'll hear more about those efforts as we work our way through our to-do list. And then for managing the workload, so one example here is we made sure that all field staff and leads and supervisors in our on-site sewage and drinking water resources program know how to conduct a property transfer inspection. We do thousands and thousands of these every year, and summertime is our busiest, and it can really, one slow day can put us behind. We have a 10 business day kind of unwritten agreement with our community and the public that we will get them their property transfer inspections as quickly as we can, because we know that that can hold up the process for folks. So we now have more people that we can call on when numbers start to increase, and we are at that point currently right now. Next slide. So modernizing technology. Big one that happened last year was we switched to a new database called Acela. But one of the really cool things about this database is that we now link to parcel data. So it automatically pulls and pre-populates into an application that a customer is entering. Our professionals who work in this database a lot, submitting a lot of applications, really appreciate that they don't have to enter that parcel information themselves, that it just automatically shows up, which is a wonderful time saver and also reduces the number of data entry errors that might show up. The right the first time on the intake. So this is kind of an interesting story. So recently we launched a website that lists out all of our permitted commissary kitchens, their operators, contact information, and then also the amenities that are available at that commissary kitchen. Not all commissary kitchens offer the same resources for the vendors that use their space. This allows, for example, a mobile food truck operator who's looking for a commissary kitchen to choose the best fit the first time before submitting their application. And then we don't have to reject it because we know that that commissary kitchen may not accommodate the processes that they're putting forward and want to use on their mobile food truck. So this kind of is a way for also some wonderful consequences of this is that we've heard from our commissary kitchen operators that they are now able to pay their bills because they have more people who know that they're out there as a commissary kitchen. So that was a great benefit. And this also reduces the number of public records requests that come through because previously that was how folks knew the entire list of commissary kitchens in the county was to actually do a public records request. So saves time on both our end and their end. And if anybody's curious, there's about just under 80 permitted commissary kitchens. It's a very cool list. You should head out to our website and check it out. And then lastly, on policy and team alignment. So you've heard us talk a couple of times, and we talked today too about some of the options for operation and maintenance of septic systems. We petitioned the state to reduce the routine inspection frequency for certain types of septic systems throughout the county. So we were the first in the state to do this and are really proud and excited to offer this option to homeowners. It really reduces the financial burden related to maintaining their septic system while also still being protective of public health. I'm happy to answer any questions.
Thank you. Are there questions from board members? Not seeing any, so thank you for the follow-up
Hand this back to
presentation.
Benji.
I'll just say I see the list online here. It's very, very cool.
It's an impressive list.
Yes, there's way more than I thought.
Absolutely. So bringing this home for you, the next steps in all of this work as we move forward is to really combine our process improvement work with our performance measures work. They're different from each other, but they're also very complementary and interrelated. So performance management really focuses on tracking and monitoring progress toward goals, while then the QI aspect of that is that we use that information to test and implement changes that improve results. So as an example, performance measures might track childhood immunization rates quarterly. If rates decline in certain communities, a QI project could test a reminder system, an adjustment to clinic hours, partner with community organizations to improve access in a number of ways. And so as we meet with the teams to determine their performance measures and get more specific on their work and connecting it to the strategic plan, our performance project management office and everybody that's working in these areas are looking for these quality improvement opportunities along the way. So it's a very symbiotic relationship between these two bodies of work. I wanted to give a shout out to Doug Lotes, who's our quality improvement guru. Doug has already forgotten more than I probably will ever know about QI, so I feel like I'm channeling my inner Doug doing this presentation. But we're on our path here, and I'm excited to see that we really are doing a number of meaningful improvements throughout the organization that will add up to more than the sum of their parts by 2029. Hope this gave you sort of a sense and flavor of all of that, and I promise I'll go back to the fireworks, the picnics, and the puppies next month.
Well, thank you for the work there. I'm looking to see if anyone has any follow-up questions. And I know I just have one. So I think change is hard. So to you, Mr. Biddle, or to any of the presenters, how have you supported staff as you've implemented these changes? Some of them were changes on top of changes. And I'm just curious how the department, I'm just going to let anybody who wants to chime in just talk me through some of the thinking.
Yeah, I will say that the first and overarching thing about the whole quality improvement roadmap is really change management. So learning that and driving that process is embedded from the beginning. Then
Yeah, thanks for the question. Involving the people who are working on the processes is key, right? So staff who are actually working on the recruitment process, or the person who we hired to run the volunteer and intern program, right? And our internal, a lot of times in administrative services, we talk about our internal customers. So those in the programmatic areas that we serve, because really we're here to make their work easier, get programs and services out to the community. So when I have done quality improvement, process improvement work in the past, that's one of the biggest things that help staff, right, work through the change, is if they are a part of creating it themselves. So that's a big one. The other one is always, whenever possible, look at data and share the data with staff so they can see the rationale and the why behind the improvements that we need to make. So those are kind of two things that I know I do.
Thank you. Any additional questions? Okay, not
Thanks
seeing
very
any,
much.
so thank you very much. So as I said at the beginning of this meeting, we do have an executive session. Mr. Jacoby, do we have a time expected? 30 minutes. Okay. So we're going to ask the clerk to read in the fun stuff about why we have 3 items I think we're discussing. Can you?
The board will hold an executive session pursuant to RCW 4230-110-1I to discuss potential litigation, RCW 4230-110-1F to discuss complaints brought against a public employee, and RCW 4230-110-1G to discuss the performance review for a public employee. The executive session will last 30 minutes and no action is expected to be taken following the executive session.
Thank you. And because we are going to have to move to get to our executive session, I'm going to suggest that we'll be back to, again, no other business coming on after that other than adjournment, come back to regular session at 4:40. That'll give us a couple minutes to get there. So we are in executive session. Thank you. We don't have a countdown. Good afternoon. The Board of Health study session, executive session has concluded. It is 5:01. Seeing no other business before the Board of Health and study session, we are adjourned. Thank you, everybody.